Okay, we seem to have plateaued for a bit, so we'll just let the others catch up as they log in. So I wanted to welcome you to our last steering committee meeting of the year. We'll probably plan another one for January or February, but we thought it was time to get the group together and feature some of our partners that haven't been featured before with some new reports. So we're really excited. We have a good turnout. We're up to 41 and it's still climbing. So we really appreciate all you taking the time and effort to be on here. We've had some schedule changes and we're reordering a few things on the agenda. So I won't be doing my presentation till a little bit later so we can allow some of our other partners to get on and off. But regretfully, the governor, who we had been working with and had a script all ready for him to talk about some points and stuff, is not able to participate. There's this little thing called a virus that's running around that's sort of commanded his attention again. So he's had to run off and try to slay the mini dragon and won't be able to be with us. So his role is going to be played by Lori Chris, and she is going to channel the governor. And the same thing with Alicia Nelson. She called me yesterday and she had to go to Washington for some meetings on similar issues. And so Lori Chris and her staff are going to channel her as well. And since I'm on the Recovery Ohio Council, I'll fill in with a few comments after Lori and her staff talk. So since we don't have the governor to greet all of us, we are then going to go to Rick Keller. I think Rick is on the line. My screen is too small to see everybody, but Rick is going to bring you greetings on behalf of PEGS Foundation, who's our main funder and our main partner and moving and shaking in all sorts of directions right now. Thank God they came into my life and got involved in this space. So I've been very appreciative. So Rick, everybody's pretty well familiar with you, so take it away.
Thanks, Eve. Appreciate that. You know, Justice Stratton, I would say I could argue the same thing, that thank God you came into our lives, because at the end of the day, as a funder, there's limits to what you can do, and finding the right partners and maybe empowering them. Not that you needed us to empower you, but facilitating. That's a role that we can play, obviously. And you know, on behalf of my board, staff, Tom Craig, who's really the backbone of a lot of what's activated our work across the state. Yeah, I saw Terry Russell on here too. You know, Terry played a significant role with our founder's son when he was in an austere situation. And, you know, Dave's mom, Peg, who our foundation's named after, got on the phone with him and he said, well, I can help you. How soon can you be here? And she said 2.5 hours, which is about the drive from Hudson to Columbus, to where her son was. And so NAMI's been a great partner, and I would mention everyone else on the screen, and I won't do that. But what I do want to say is I welcome everybody, you know, in the steering committee, is that, you know, as we travel and we hear from funders outside of the state, and honestly across and within the state, our state is well regarded for the work that the governor and his directors are doing. And I think I saw Director Stickrath, and there might be a couple others. And of course, you know, Director Chris is here too with a good portion of her team. You know, sometimes inside the state, we wonder, like, hey, are we really making headway? And I'll tell you one, for sure we are. And the second thing is how we're regarded from the leadership, from the top down, is that we're a state that others want to emulate. And I just commend that as a great opportunity as we go forward in the work that we're part of. And some of the adjacent work that's happening, but a lot of it, and I would argue most of it, is due to this group and the associations and the different folks within and outside of government, and also folks with lived experiences that have informed the work of this steering committee and the Stepping Up project. That the reason why we're able to be regarded that way, and the reason why we have such a great opportunity as we go forward, is because of the work that you all have done, and I appreciate it, and I think every once in a while it's helpful for us to remember that and think about that, and just as we move forward, to help the folks that we know, you know, suffer daily, and we can, you know, folks with addiction, folks with serious mental illness, and other behavioral health disorders, that how we respond to them, support them, and actually get them on a pathway where they can thrive and be a valuable part of our society is important. And so much of this collaborative groundwork, Justice Stratton, that you've helped create with, again, a whole host of folks is very important. And it's why we're where we're at today. And again, the last thing I'll say is thanks for everybody to participate and continue to do so, and to realize that, you know, as a state across this country, we're thought very highly of, and I think that it's a great thing, and it's something that you all need to reflect on and be proud of, because it's important. And I'm grateful to be part of this group. PEGS Foundation is, and I'm grateful to my partner Tom, who is different personality than mine, but I think as a team we empower each other, and I appreciate the hard work he's put in as he's traveled the state. So thanks, Eve.
Mm-hmm. So I, again, so appreciate what you are doing. And I just have to brag on Rick and Tom a little bit. They are now involved with a lot of big national funders, foundations like Pew and MacArthur and some others, Meadows, and they don't have nearly the amount of money that these groups have. But I think that their method of working, their partnering has been so effective that a lot of these foundations are really looking to Rick for how did you do it in Ohio, and what's the secret, and so we're small but mighty in the foundation world. So I'm really proud of Rick and Tom's leadership on the national scale. I'm on the American Psychiatric Foundation board now. Yeah, so there's like 14 psychiatrists, a baseball player, and me. So it's kind of a hoot. But they really regard PEGS very highly in that arena. So it makes me very proud. So thank you, Rick, for your partnership. So I'm going to now pivot to Lori Chris, Director Chris. All of you, of course, know her. I actually got to know her first when she was head of the Providers Association and was a client of a firm, Vorey's firm, where I work part-time and do appellate coaching and some other things. But so it was wonderful that she got elevated to this position because she knew boots on the ground. She knew how it operated. She was qualified. She really understood the system, and she has just been a fabulous leader and a fabulous partner. And she's going to talk a little bit about anything the governor might have and anything Alicia might have, and then their own reports. And I think Lois is going to tag team with you because we've got some really exciting things happening with the multi-system adult proposal, which I think we're renaming, so you can let us know what that is. So take it away, and you have extra time, so don't feel like you have to rush.
Very good. Well, good morning, everyone. Thank you so much, Justice Stratton, for the introduction, and Rick for those opening remarks as well. I will say the governor really does send his regrets. He had this planned. We've been talking about stepping up and the good work, and he's always got an eye towards this work. I think you know well that his service as a prosecutor has really helped, and his undergraduate degree as an educator, right, have really helped form his passion for children and youth, and then understanding those men and women who are experiencing mental illness and substance use disorders, and that intersection with the criminal justice system. So he deeply regrets not being able to be here today. But as Justice Stratton said, the pandemic has certainly drawn him away from this meeting today. And Alicia Nelson as well. I will first and foremost just say thank you to the Stepping Up Committee. I feel like when I look at this team, we all interact so frequently. So some of what I'll be sharing today may not be new information, but I hope that we can have some discussion around it too. But from the governor, from me, from Alicia, thank you to the Stepping Up team and this whole group here, because the work that you've continued throughout the pandemic, moving to a virtual environment, has been really energizing, I think, for Stepping Up in a new and different way. These virtual meetings have drawn in more local partners, and greater participation have enabled those local meetings to really bring in some new communities. And we're just thrilled with the energy and enthusiasm and leadership that this combined effort has. And you know, we know that we're building on good work from years past, and appreciate that strong foundation, and then marrying that with the governor's priorities really gives us a strong platform to work together from. In terms of Recovery Ohio, we just had our advisory council meeting last week, and I know a number of you were on that meeting as well. I'll just share with you some of the work that we're doing as across agencies that Director Nelson's leading there. And Tom Stickrath, if you'd like to jump in at all, certainly please feel free to share perspective and color commentary too. From the public safety lens, but we really are working across a number of different areas under the leadership of Recovery Ohio. One of the first ones that I'll just mention briefly is data and how we can better use data to understand the challenges that exist in multiple systems, and then use that information to inform strategies and solutions, either in programming or policy or resources as well. And so there is a data meeting that is specifically for those local government partners, the law enforcement, Adam boards, public health departments, really looking at drug enforcement data and overdose data, and then looking at the intersection there. And that work is happening under DPS's leadership. But we're also working with the Lieutenant Governor's office and the Department of Administrative Services for the IOP platform, that Innovate Ohio platform, where all of the state agencies are putting data into the platform so that it can be accessible and usable for local planning, for specialized groups to access and plan as well. And we have specific work underway in the behavioral health space to make sure that behavioral health related data is in that space as well. And so that's work that Alicia Nelson's leading. We have launched the Overdose Strike Force, which is working to have some targeted initiatives in those areas that are demonstrating the highest number of overdose deaths or the highest rate of overdose deaths. We know that there are 23 counties that are contributing to 80% of the overdose deaths in Ohio. And so we're looking at how we can work together with interdiction, prevention, harm reduction, treatment, and recovery supports to turn the tide of overdose deaths in Ohio and take into account those very specific areas within those counties that are hardest hit as well. So really looking more at the neighborhood level, the zip code level, and working with the local community partners. And we're starting into those local conversations as, offering support, data, resources, technical assistance, and helping to really close the gaps where gaps exist. We know that adults with serious mental illness often or sometimes have substance use disorders as well. And so there's an opportunity for the stepping up work to really intersect with those SAMI clients too. And we know that minority communities are being very hard hit with overdose deaths. The rate of overdose death among Black Ohioans is increasing at a different rate than a higher rate than white Ohioans. And so we're looking at the equity issues there in terms of access and capacity to be served, and also equity and outcomes for the services being delivered and provided. Suicide prevention is work that's also being coordinated across many agencies with Recovery Ohio, with the governor's office. And this month is Suicide Prevention Awareness Month. And so we've had some additional efforts there in terms of just increasing visibility, but we're still working diligently with Tony Coder and the Ohio Suicide Prevention Foundation to implement Ohio's strategic plan for suicide prevention, and really grateful for and proud of that work. We are engaged in a anti-stigma campaign, and we're working with the Franklin County Adam Board, who was part of that work previously in the Denial Ohio campaign. and is now helping us work with Nationwide Foundation and other partners to have a statewide stigma reduction campaign. So more to come on that, but that's in development right now. And the Department of Insurance is increasing their look at parity enforcement and toolkits for employers and how to help employers really understand how to what they're buying when they're buying benefits, and then how to make sure they're getting what they're investing in through those benefits as well. So really grateful for Director French and the leadership she's providing in that. So I see a hand up, and I'll stop for a second.
And thank you, Dr. Chris. I just wanted to lift up Sally Lucan's question. Yes, her mic isn't working.
Sure.
If IOP is similar or different to the Ohio Human Services Data Warehouse, which Sally and I have been working with Cuyahoga County on, as well as folks over at the Ohio Housing Finance Agency and their data warehouses. Just wanted to lift your question up.
So the IOP platform is one that all state agencies will be contributing data to. And the Human Services Data Warehouse, I don't know enough to speak specifically to how that's organized and its relationship with the IOP. But we could certainly get more information. And actually, that might be something that the Stepping Up Committee would be interested in having a presentation on, is what the platform is, how to access the data, and how the data can be used.
Thank you so much.
So those are some highlights from Recovery Ohio. Justice Stratton, you might want to add in some other perspective or comments, and I know a number of you are on the Recovery Ohio Advisory Council, so certainly please feel free to add any comments or questions as well.
I don't really have too much to add. I really appreciate being on the council. It now enables me to make sure they're connected with the AG task force that often tries to work on some of those 75 recommendations in tandem, and keeps me in the loop. And but it's just amazing watching all the many projects that they're working on when I participate in those meetings. It's a long list with a whole lot of people doing a whole lot of work. So thank you.
Absolutely. Right, I don't want to put any other council members on the spot, so I'll just be quiet for 5 more seconds and you can jump in if you want. Okay, so with that, I will move to the presentation from our department, and this is a slide deck it's 20 slides long, and I'm going to move through pretty quickly some of the specific initiatives that are underway through our criminal justice office, and then also some broader initiatives that really do speak to the intersection of adults with mental illness who are connected to multiple services and supports in our community, or systems in our communities as well. And Lois Hostetler is here with me, and she's going to share information towards the end of the slide deck on our multi-system adult work. So Kathleen, do you want me to share? I'm happy to do that.
It's whatever your preference.
Okay. Well, why don't you go ahead and share, and I'll
Okay.
that way I won't have to multitask while I present. Thank you.
Okay. Okay.
Thank you very much. All right, you can move to the next slide. So the first few slides are really meant to remind folks of the resources available through our department, working specifically with the court system. And this first one is our Specialized Docket Subsidy program. This is a program that was in existence prior to Governor DeWine's taking this office. And his commitment was to grow the specialized docket programs in the state of Ohio by at least 60 courts in his first term. And so as we look at this, you can see that we have expanded the number of courts. We've expanded the number of courts that are also receiving funding through the state of Ohio. And we're working very closely with the Ohio Supreme Court to make sure that we can be supportive of people in their initial certification and then their final certification, and helping to incentivize their access to these dollars. The Specialized Docket Subsidy Program covers just a portion of the cost that any court would experience, but you can see that as they braid funds together, the impact for those men and women and families who are engaged in these dockets really is significant. And we're seeing reduced recidivism rates to 2% or 1% compared to the overall recidivism rate for men and women who are charged with and engaged with the criminal justice system. So as we look at this, we have expanded our funding for the Specialized Docket Subsidy Program in the current biennium. Our intention there is to make sure that we can continue to support those courts that we added last year, and then we can continue to grow funding for new courts in the current biennium. Next slide, please. We also have the addiction treatment program. And so this is, again, subsidy that is aimed at reducing recidivism, increasing public safety, and it does support the court systems at the local level by providing funds that help the individuals who are engaged in the criminal justice system access those services and supports that will help them attain and achieve their recovery goals, while also decreasing their involvement with the criminal justice system. So these dollars are allocated to the Adam H boards, and they have flexibility in how they can be spent to support individuals engaged with the courts or the courts and dockets themselves. In the last fiscal year, over 4,000 Ohioans were served through these dollars. Next slide. And then we have the mental health court program as well. And so this program is specifically for those mental health dockets and helps to support the services and recovery supports that may be needed to help eliminate barriers to access to treatment or other recovery goals that people are experiencing. And you can see that we've served about 900 people with this subsidy in the past year. We're continuing to invest in crisis and prioritize crisis in investments in our system as well. And I think, you know, this has been something that has been top of mind for the Stepping Up Committee. We know that PEGS Foundation has been a leader in this space too, and bringing attention to the need for evidence-based practices in the state of Ohio. And so we're building on some of the work that that work and that interest, and have really invested significant amounts of money in the Crisis Continuum at the local level. And so our goal is to help people know where treatment is available, where crisis capacity is available. One of the barriers that we see in the national data sets, and it's true for Ohio too, is just visibility. There are people in need and there's services and supports, and increasing that visibility so that people can connect to the right care at the right time is incredibly important. And then also having that response that's appropriate as well. So whether it's a mobile response where a team goes out to an individual or a family, or it's a place-based response that takes a little more time and helps someone get stabilized. Our goal is to meet the crisis needs, both mental health and addiction, of Ohioans of all ages. And then really to make sure that that back door from the crisis system helps connect people to care in the community in a way that helps them thrive long-term, prevent future crises, and really advance in their recovery as well. So I'll talk for a few minutes about some of the things we have underway. Next slide. So as you look at this slide, you can see that our goal is really to help intervene earlier in crisis and to meet needs through the least intrusive way possible that actually is appropriate for that individual, that man, that woman, that child, that family. And our goal is that we will expand crisis line capacity and response in a way that we can resolve the majority of crises that an individual or family is experiencing by having a trusted, competent, trained response at the other end of a phone call. I'll talk in a minute about 988, and I know many of you will be on, are participating in our 988 steering committee, and will be on some of the briefing with that this afternoon too. But right now, calls are coming into 911. Calls are going to the National Suicide Prevention Lifeline. We have 13 of those Lifeline centers across the state of Ohio. And a great amount of work is happening to resolve those crises for an individual, either by de-escalating through that phone call or by connecting them to care through that phone call as well. Our goal is to enhance and grow that so that more families can have that experience of that lifeline being right there and available with a competent and high quality response that's geared towards behavioral health. We also are increasing mobile crisis teams in the state of Ohio, and you've seen these growing in local communities around the state through quick response teams, DART teams. There's a number of different names for them. Interdisciplinary teams with EMS, law enforcement, social workers going out. We're growing the mobile response for youth through the Ohio Rise initiative and our department working with the Center of Excellence. And I know some of you are partners in that Behavioral Health Center of Excellence for Adolescents. And so growing that mobile crisis response in an evidence-based way is an important part of the work too. We'd like people to get the response they need where they are, rather than having to go somewhere to get help. Because often if they have to go somewhere, they end up in an emergency department or perhaps engaged in the criminal justice system. Our goal is to decrease that. And then to have the opportunity for people to be in crisis facilities, so stabilization centers that are designed for high quality interventions with behavioral health crisis, to have that time for observation and then stabilization if necessary, step down to a residential program like the Adam and Amanda House in Athens, or to help avoid hospitalization or before they can return home. So again, crisis facility, building out that continuum, closing those gaps, and then that post-crisis wraparound, that follow-up after a call is made. So not just a call coming in, but then after a call is handled, having appropriate follow-up within the recommended amount of time so that that family knows that experience wasn't a one-off, but they have the opportunity to continue engagement with the behavioral health system. So this is what we're working with the national partners on, the National Suicide Prevention Lifeline partners. And this is our goal is least restrictive environment, least restrictive services, so that we can support people to be healthy in the community. Next slide. So with, again, a lot of you, the crisis services report was released in July, and on our website, you'll find a lot of information about the crisis academies that have been organized collaboratively with so many of you that have brought evidence-based practices into the state to be shared on a broad basis. You'll also find this crisis services report and some interactive maps where you can look at which services are available in which counties in Ohio, and continuing to work on how to build the services and supports out so that every county has a full continuum of crisis response. This looks at current funding strategies and highlights our efforts collaboratively to expand local crisis services. So if you haven't yet looked at this report, please do. It's a valuable resource here in Ohio. And it also helps with some of the taxonomy, that creating that common language that so that we can all be sure that when we're using terms, we're talking about the same thing, and using that to help align the regulatory and financing environment as well. We are implementing a crisis task force. It's getting launched this month, and we're excited about that. Again, appreciate a number of you are participating in that and helping really to work with our consultant that we just hired to make sure that we have a solid strategy moving forward and looking for those opportunities to strategically enhance system coordination among a number of partners who interact with Ohioans who have an addiction or mental health crisis. This will also give us an opportunity for continuous input on the framework and design and implementation of this crisis system that's happening in Ohio to make sure that we've got a continuous quality improvement mindset. And again, that we're making sure to have the voice of people with expertise in a variety of areas. So, you know, that personal experience and family member experience, and then also the clinical experience and the first responder and other community response experience as well. There's a policy roadmap that's being created right now, and this roadmap, we appreciate Peg's work and deep dive into the policy work here in Ohio, and we're looking forward to using that as part of the Ohio Crisis Task Force Committee's ability to take that roadmap and then drive forward with what needs to happen next in a variety of areas where we can make improvements. Continued work underway is, you can see lots of areas where we are being sure to include in our strategic efforts. So data, I know, Sally, you asked about that. It's a top priority for the Stepping Up initiative. It's a top priority for our department as well. And having solid data so that we're planning from that and not anecdotes is important to us. And nationally, this hasn't been a strength of the behavioral health system, and I think that we have a great opportunity to grow that and make that data a bigger part of how we're operating here in Ohio. But you can see that we have a number of areas that we're working on, and our consultant and the task force will help us navigate these waters. Next slide. 988 is a new initiative that was passed in federal legislation in October of 2020. Ohio started having conversations around the implementation of it in December of 2020, and then we began our planning grant around implementing the 3-digit number 988. It, at its most basic level, it's a 3-digit number that by next July will be available across the country to replace the national 10-digit number that operates through the Suicide Prevention Lifeline right now. And, you know, in Ohio and in some other states, the vision is that 988 is not just this standalone call center, but that it's pulled into and an integral part of our crisis continuum and that response. And that we are, you know, we're moving to a point where families won't have to think about, is this, you know, suicide crisis, or is this a behavioral health crisis and I need to talk to someone who will help me sort through what the right next thing is. Is this a matter of harm to self or harm to others that needs a specific response, or is this an addiction or mental health crisis that perhaps would have a different response? And so we're really moving towards 988 as that integral first on-ramp into crisis support services in Ohio. Next slide. I kind of covered that in the last slide. So let me just say a couple other things though. We have a really robust planning committee. Over 100 people have been engaged in this work, and it includes, again, people with lived experience of mental illness and substance use disorders, family members, law enforcement, EMS, clinical services providers, ADAMH boards, call center, call lines like 211. We have the 911 administrator for the state of Ohio and other first responders from that standpoint, helping us look at interoperability. I'm sure I'm leaving some folks out, but this really robust group of people who are helping us look at 988, the current suicide prevention lifeline providers as well, and helping us work through a number of areas that we need to be mindful of and strategic in planning for the implementation next July. So that not only will people have a number to call, but when they call, they'll get a quality response, and that response will be more than a phone call if necessary. It will actually be linked to services and supports. Part of what we're building out is an online resource so that every call center in Ohio will have access to a database that is relevant locally for any individual that's calling the line. So that if a call comes into Cincinnati, but it's from Northwest Ohio because it rolled over for an in Ohio call, that provider in Cincinnati will be able to look at what resources exist locally for that person in Northwest Ohio. So we're building out a variety of responses. We are releasing our interim report that is based on the landscape analysis, financial analysis, and the committee work that's been done to date. That will be released next week. And so look forward to that. That will give us a good opportunity to take that interim report with feedback from this group and others to produce our final report that's due in January. So perhaps that's something we can come back and dive into more deeply with this group as well. Senate Bill 2, this group, I think, could talk more about Senate Bill 2 than I probably can in terms of your engagement and involvement in getting this piece of legislation to a point that's helpful for Ohioans and helpful to making sure that people with misdemeanors who also have behavioral health conditions and need competency restoration can do that in an outpatient setting if that's possible, or just have the charge dismissed altogether and go to probate court. So this became effective in August. We're already starting to work through the process at the local community levels, including with our regional psychiatric hospitals. There's a lot of work to be done. We can move to the next slide. And I know that a number of you on this steering committee, as well as other partners, are engaged in developing trainings on how to implement Senate Bill 2, have already identified some challenges with implementing Senate Bill 2 that are causing us to circle back around and look at what we might need to amend or improve in that language as it exists. We're working with the Supreme Court as well, who is developing some bench sheet-like guidance for judges so that they can implement this language, this new initiative, but also restoration to competency in general in ways that are most helpful to the men and women who are needing that service and support. So I think it would be worthy of, I'd suggest this again for a future discussion. Dr. Gordish and Dr. Baker from our team are deeply embedded in this work. We have new resources available for forensic competency restoration and misdemeanor competency restoration. And I think it would be worthwhile for all of us to spend some time together and walk through what's emerging through the department and in partnership with local communities around the state. So happy to dive deeper into this in a future agenda if that's of interest to the group too. And then I will turn the next set of slides are here over to Lois, who will lead us through this Enhancing Wellness Project initiative.
Good morning, everyone. I did a presentation about this at our last meeting, but Justice Stratton asked me to share a little more because at that time, we were still in the information gathering process. We had a pretty robust input from community members, some of you who are on this call, as well as a number of other folks, many of whom touched the Stepping Up initiative across the state, as well as some State Department partners, as well as our internal partners. While this is an $11 million project over the biennium, we know that this is a small piece of projects that touch individuals with mental illness. We identified 24 programs or services that our department either funds or touches in some way individuals that touch individuals with mental illness. So while this is a little more high profile, and so you may hear about it know that there's a lot of other work done in this space. Director Chris touched on a couple of these very significant ones, the specialty dockets and crisis. But obviously there are a lot of other ones, CIT work that we do, a project working with individuals in nursing facilities, the criminal justice CCOE. I could go on, but there are a number of other things, and I'm highlighting the multi-system project. So you'll sometimes hear this called the MSA project. We officially wanted to call it the Enhancing Wellness Project. So you may hear that also termed. What we wanted to really emphasize is that our goal is for this project is wellness. It's much more holistic than simply being stabilized enough to get out of the hospital. We want to help these individuals attain wellness. So there are a couple key parts to this. The most significant being is a systems collaboration approach. We know that there is a lot of good work happening in this space around the state, and this project is designed to support those projects. It's not designed to replace any of them. A lot of the communities that we know have strong stepping up initiatives, and that's often a starting point for the systems collaboration that we are hoping to do. We have asked each of the ATOM boards where the money is flowing through to do a couple of steps in terms of developing an individualized plan for their community in terms of how they're going to be implementing this project. One of the big questions that we had is, how do you intend to work on a systems collaboration standpoint? What do you need from the state? How can we be a support as a state and as a local resource to helping progress in this area? The target population is what we're looking for is we're really looking for those individuals who cycle in and out of the hospitals and also touch other systems. Next slide, please. So this is the working definition that we're using for the multi-system adult project. So this is an adult with significant mental illness who also has 4 or more psychiatric hospitalizations in the past year, or 3 or more in a month, and is connected to 1 or more other systems. One of the things that our group, probably the most highly contested, if I may say so, in terms of identifying the population, this was really tough. We wanted it to be as expansive as possible, but also wanted it to be a small target population because we wanted it to have enough money per individual to help it be a significant part of their recovery support. We ended up settling on 4 or more psychiatric hospitalizations. We looked at some aggregate Medicaid data, and this, unfortunately, there were about 2,700 individuals on Medicaid who met this criteria of the 4 or more psychiatric hospitalizations in 2021. We know that this project won't affect all of the individuals. Our target for the year is 1,000 individuals, which backs us into approximately $4,000 maximum per client for the year. Next slide, please. So these are the systems. So in addition to the psychiatric hospitalizations, the goal is that these are individuals who are complex. They touch other systems, and we know that that adds to some of the needs that they have. So the 5 systems that we settled on were criminal justice, developmental disabilities, over 65, homeless, or a veteran status. So we know that there is a lot of work being done in the criminal justice space, as all of you who are on this call know, and there's a lot of work in this area. But there are other populations too, other systems that we know that really need strengthening. And so we wanted this project to touch more than just the criminal justice population, even though that's a very significant one. Next slide, please. So as I mentioned, there are 2 components to the project. The first is the systems collaboration, because our goal is to strengthen the communication and collaboration between systems. We want to build on existing resources Obviously, I mentioned from the beginning, this is a big pot of money and it's a tiny little pot of money at the same time. And so we want to make sure that this project is utilizing other resources in the community, whether it's the 24 other projects that I mentioned that our department is involved in, also resources that are existing on the local, state, and federal resources such as HUD vouchers. Obviously, Medicaid is a significant piece, as well as existing supports within the community, such as our First Episode program. We know that the collaborations, as I mentioned before, are focused on, as much as possible, existing coalitions or collaborations or communication systems. Every community calls it a little something different, and Stepping Up is one key piece, but it's an expanded version of that. We know that the individuals that we serve within the Stepping Up community may be also touched by some of the other systems that we're talking about. Next slide, please. So we wanted to make it as comprehensive as possible, and this was part of our gathering of information as we started to shape this project. And these are also individuals that we anticipate being included in the individual board areas as they're working on systems collaboration. So we have a wide variety of folks, many of whom may be represented on this call. You may see your organization or entity included in here. And so these are all very valuable parts of the process. And we want to make sure that we are doing our part to be holistic as much as possible and as well as comprehensive. We know that not everybody is going to be involved in every community, but our goal with the systems collaboration is that the needs are met by as holistic an approach as possible. Next slide, please. So the other key piece is a recovery supports. One of the things that I really wanted to emphasize, we intentionally use the word person-centered use of funds. This is a project, I know you've heard NAMI talk a lot about from their perspective of some of the advocacy work that they've done. And this is a piece that we really wanted to emphasize with this project of approaching the project as a person-centered collaboration. We want to make sure that as we're using recovery supports, it could be things like housing supports or transportation, a lot of gap supports that are small things that make up some of the gaps that happen. And so we want to make sure that they have an opportunity to use funds from this project in order to give them the best chance for wellness in the community. One of the key things that we know that is a gap is mental health peer support. And so a number of the boards are looking to see how they can access that resource as a key component, whether it's simply maybe it's a certified peer supporter or whether it's a peer navigator. Those are some of the models that are going to be used across the state. Next slide, please. And that's the highlights. So we are really excited about this project. As I mentioned, I know it's only one of a number, but it is a very visible one, and we're really hoping for some great success. So we are hoping everyone from this call will be able to support it in your own local community and statewide.
And I do want to add on to the person-centered comments, and really do want to thank NAMI for your partnership in helping us think through how to approach and invest in person-centered experiences, and really look at some models that exist in other systems to make sure that people with mental illness who are involved in multiple systems and experiencing high rates of institutionalization are at the center of this, are not lost in this mix of all these people here to help them, right? That they are saying, this is my goal. I want to work, or I want to go to, this daytime activity, or I want to volunteer, I want to go back to school, I need this type of housing, that they're helping to drive that work, and that the systems are here in relationship to one another to help support that individual's goals. I think we talk a lot about person-centeredness. I think we do a lot of good work in person-centeredness. I don't think as a system we've focused on person-centeredness the same way that other systems have. And so this is an opportunity to spur that, to incentivize that, and to really help learn from it and continually improve our behavioral health systems efforts at being more person-centered as well. So I want to thank Terry and our friends at NAMI for keeping that center target for us in this work too.
Lori,
Thank you.
this is Terry.
go
Lori,
ahead.
this is Terry. First of all, I want to thank the department for, first of all, the governor for putting it the $11 million in the budget to do this, and stepping up this group here today, that they recognize that this is just the start of a personal-centered care approach to the severely mentally disabled, and that there will be people critical that we're only going to address 1,000 people. I understand that, but it's a start, and we're hoping at some point when we see this work with those 1,000 people that they're not living what we've all watched for years and years and years of prisons and homelessness and on and on and on, that there is a change in their lives, that they can live a productive life. And when we see that, then maybe we can shift our system gently towards more and more and more and more. So we really ask the steering committee here at stepping up to be behind this, because this is all about your goals too, of really addressing the needs of those citizens out there that find themselves really, think about it, 3 or 4 times in a hospital in a year's time, or 3 in a month's time. We hear it all the time here. Families call us daily and are telling us, my son's been here, my daughter's been here. So thank you. I just can't tell you enough how appreciative we are that the governor put the money in, and then the implementation appears to be going in a way that is really personal centered. Thank you.
And thank you, Terry. And it's hard to put together a brief presentation on all the different things that are happening in our department and across the departments too. Sally, you asked a question about, is the $4,000 an estimate or a cap? And I can let Lois answer that from a technical standpoint, but our intention with this is to spark relationships at the local level and to bring resources that exist into, collaboration together to advance the goals of people with mental illness. And to help them thrive in our local communities and not need hospitalization or not end up in jail or prison. So we know there are a lot of resources available, but that oftentimes a person has to move from place to place to place to figure out what those are and to access them. This is why it's person-centeredness, but also that system relationship, system collaboration to bring a host of resources together. If someday I'm continually adding presentations we can give to you, but we do have so much other work that we're diving into for adults with serious mental illness, and expansion of first episode serious mental illness work, looking at day services and how to expand that, looking at navigators. And some of this is a benefit of having some federal dollars that we can invest differently now, but just helping us stimulate and grow this work and learn from it so that we can build it into, as Terry said, future plans for programs, for policies, and for resources as well.
In terms of the $4,000 for this first year, it is a cap. Although if there's a specific situation, we can talk through that, working with the communities for that. We did it intentionally because we wanted everyone who's eligible for this has a lot of needs. So we wanted to make sure that we weren't simply doing someone got bus passes and so someone else gets a lot. We know that there are a lot of needs in that area. There are a number of these things we're going to be reassessing after the first year. And so if that's one of the things that we'll take a look at and we'll take into consideration, but for this year, right now, that's where we're landing.
Betsy has her hand up too.
Okay.
Hi, Director Chris. I just wanted to point out in your slide on Senate Bill 2, you mentioned that being probated to a hospital is one alternative for competency restoration, particularly for low-level nonviolent offenders. I just wanted to mention too that assisted outpatient treatment is also an alternative.
Okay. Thank you. And we can update that slide, Betsy. Thank you. The other thing that I'll mention, just as a last comment, is we're also bringing up regional liaisons again. This is something that we have been asked by a number of different constituent groups in terms of how we can have more local presence and really support efforts at bidirectional communication, helping our local regional partners have a point of contact with the department who can then help them get to the right person in a role and get answers to questions or access to resources. It'll be very helpful in the crisis support work that we're doing, the multi-system adult enhancing wellness project. So we just posted these positions within the past 2 weeks. We're excited to be able to bring this forward again as a resource in partnership with all of you as we work to implement the strategic plan too. So if you haven't seen that, look for it. It's still posted. Share the word.
Okay. Well, thank you so much. And basically listening to you makes my head spin. There's so much going on. And I know for a fact that Lori doesn't sleep because I get emails and texts from her at 10 o'clock at night. So, but it's just so much that you are doing in so many fields. And most of you know this, but Lois joined our core team for Stepping Up and has been appearing at all of our countywide meetings and giving everybody updates on funds and projects and the multi-system adult and et cetera. So she's really an invaluable part of our core team for Stepping Up. So thank you, Lois, for your role in that way as well. I don't know if Sally can, in the chat room, put a link to the housing infographic on making the business case, but it's a really valuable tool to use if you're partnering locally. It just shows, she took one individual from Delaware who had been in the court system, the jail system, the hospital system, 300-400 days each over an 8-year period, no outcome, good outcome, just kept cycling through. They put him in robust supportive housing with all these services wrapped around him. Had they done that from the beginning, they would have saved over $400,000 over those 6 or 8 years. I forget which it was, but that just shows you that doing this multi-system approach really ends up saving dollars because they stop cycling through these systems with no good outcome, and those monies can be reinvested. And the way I look at it, the $4,000, it's supplemental. It's not, that's all we're going to spend on these people. It's, let's use this money to supplement trying to get them linked with all of these local and statewide services that they may or may not be accessing or cycling through with no good outcome. So I think this approach will really, in the end, free dollars that are now spent on somebody with no good outcome and give them a better quality of life. So I think it's a wonderful project and I'm really excited about it. So, all right. Well, thank you so much. And thank you for all you do and how many people are on. I'm going to talk about the Attorney General Task Force later, but half of them are staffed fully with all sorts of mental health department personnel, so they just keep us really connected. So anyhow, so I wanted to then see, is John Lights on the phone or on this? I couldn't find him on the list. Is he ready to give? Because I know he had a time frame. John, are you available to give your report now on county commissioners? Are you muted? Or are you not there? Maybe he's not on yet. Okay, I'm not seeing him, so I will catch up with him later. He might be jumping on a little bit later. And I'll send him a text. So I'll go back to the agenda now, and I'll give a little bit of my report. I always like to think very positively about what's happening. And when Melissa Knopp and I were at the court, we had started with, I believe it was 7 drug courts. And there's over 200, almost 280 specialized dockets now, thanks to the governor and all of the support he's given with the funding that he's allocated. When I started pushing CIT, which I thought was a very important complement to the mental health stuff, mental health courts and pushing mental health courts, we had 100 CIT officers trained in Ohio. We just topped 14,000 officers trained, and every one of those 1,000 is so connected to the community. They now know where the resources are. They now know where they can take them off. But it's also created sort of victim of our own success problem in that there are so many officers trained, but there's just not enough places to take them to. There's no real robust crisis system, which is why the crisis work is so important, because if they take them to a drop-off center that's full, like net care, is full, doesn't have any beds, they have to take them to the emergency room. They can't afford to sit there and wait for 4 hours. So they take them to jail, and where you have a crisis drop-off, that could make a difference. But hopefully that crisis drop-off, if you could get up the system and get people taken care of before they get arrested, that really brings down that number. But anyhow, that's why we really need now to get enough crisis work in place to support the officers who are trained, so they have some place to go or someone to call on these. And the 988, I think, will be very helpful too, if they can triage them off to mental health professionals if they're not at the level that they need the police intervention. So really grateful for that, and especially grateful to the legislature. The administration put forth a very robust budget for mental health, one of the best I've ever seen, and the legislature didn't cut it. So that's a real challenge sometimes. That's a real battle, and I'm really, really appreciative of that. So very grateful that they didn't cut it, and I thank the legislature for that as well. So I want to talk a little bit about the Attorney General Task Force committees. We are now almost 500 strong. We are now up to 14 committees. Would love to have any of you that are interested join any of those committees, although I think half the people on this call are part of one of those committees. We have the Competency, Restoration, and Probate Issues Committee, which is a new one, which is working with OMAS and a lot of stakeholders on this call to try to figure out this bill. It got so many revisions and so many cooks in the pot that we just said, okay, we've got to pass it, get it going, and then we can go back and try to fine tune it, which we are identifying some issues, but we're just got a lot of partners, a lot of interest. If you're interested in that, we have a mental health and mental health in the jails, mental illness in the jails committee, which is actually focusing on training. They did a very good 1-hour webinar on long-term injectables and psychotropic drugs that are being used. They're now working on a basic sort of, it's more than mental health 101. It's really helping jail personnel. When you see somebody they're acting out, what are you seeing? What is it likely to be? How can you, really identify it? And then there's a 3-part series of taking what do you do with people coming into jail with mental health issues? How do you handle the medications, the continuity? Then the second part is how do you deal with them when they're in the jail? And the third part is how do you deal with them when they're releasing them, connecting with services? These are all going to just be 1-hour webinars that can be sent around to all sorts of entities. The first one is available on the OMAS website. We're working on grand rounds. This is something Melissa and I worked on when we were at the court, where we'd go in and teach the psychiatric students about what mental illness in the courts looks like and jails looks like, take them down to watch a specialized docket, go back with the judge and participate, go in front where you have the hearing. We've renewed this. We've got our first one October 6th. That's Dr. Doug Smith is presenting. Judge Heath is talking about the court side. I'm giving kind of an overview, and Dr. Victoria Kelly, who's very involved in the criminal justice work with the University of Toledo Psychiatric School, is also a presenter. And we have, again, a several-part series. The next one's going to be on interacting with CIT officers and police when you get out into the practice. And then the third one will be the probate side, the AOT, the guardianship, et cetera. So again, these are going to be sent after they're going to be taped. They're going to be sent to all the medical schools, all the training programs, and all the hospitals to try to ramp them up. And so we're really excited about that. Our housing committee for the AG Task Force is just going strong as can be. I really encourage you to join that. They've got a meeting coming up here in October, working on the landlord mitigation fund and all sorts of different projects. Every one of these committees is really, really very, very active. I think of them as our action arm for stepping up, because it's Melissa and me and a few other folks that at PEGS, and we don't have the ability to do all these projects. And so we kick them over to the steering or to the AG task force and to one of those 14 committees and say, hey, can you work on this project or this idea or this legislation? And they have just been so responsive this year. So we thank the Attorney General for his support of that committee, which is really, really good. And thank you for OMAS and other partners on this call for being in on almost all these committees. So we thank them. Wanted to add that we've just added a new steering committee member. He's actually an employee with the Department of Corrections, John Adams, but he heads the Jail Advisory Committee, and we really need to be collaborating more with what they're doing, since a lot of stepping up work is with jails. So we formally added them to the steering committee. You'll get an updated list, and we're asking them to have some representation on some of our AG task force so that we're not duplicating, or we have their voice, or we have their input, and getting much more connected with the work that they're doing. So that's just a kind of a quick summary of some of the things that I've been working on. I'm going to kick it now to Melissa Knopp and see if she wants to go into much more detail on some of the boots on the ground stuff we're doing, and then a survey that we are working on and giving you a preliminary report on that. So Melissa, take it away.
Hi, can you all hear me? Are you able to hear me?
Yes, yes.
I'm sorry, a little bit of a delay, I guess. So I wanted to give an update on our work with the counties, and just give you some information too on the preliminary report that we're receiving from the Bowling Green State University. So for our county work, we had 3 counties registered since our meeting in May: Licking County, Marion County, and Huron County. And we are continuing to work with the County Commissioners Association to get additional counties registered. Right now, we've targeted Geauga, Lawrence, and Warren County. We've had local folks reach out to us there and, want to start the process. So we've been working with them. Since our last steering committee meeting in May, we've held 5 county meetings. As I think Lori and Justice Stratton both said, these are all virtual meetings now, and we've really seen an increase in these virtual meetings with attendees. We've had between 40 and 70 folks attend these meetings, so we're really having great responses. The 5 counties that we held meetings in were Licking County, Mercer County, Clark, Stark, and Marion County. There's 4 county projects that we really want to highlight that we're pretty proud of and that are going very well. We have in Delaware County, as Director Chris stated, we've been working with them on peer support, but we're focused on peer support with criminal justice involved folks. As you may know, if someone is under supervision by a probation department, the requirements for peers are very different than what they are in the community because of the rules of probation and the rules of supervision that these folks are under. So Delaware County is working with a local group, the probation department, and we're trying to establish with their local peer group a set of peers that would be appropriate and available for the criminal justice population. Also, probation CIT has been a project that we've been working on very strongly. NeoMed did some statewide trainings for the probation officers on CIT last year, which were extremely well received and very, very needed and very successful. And we also have 3 common pleas adult probation departments right now working on creating actual crisis intervention teams. Not just going through the training, but creating a team that is developed to respond to folks under supervision with these issues and working closely with their local law enforcement CIT officers. Another project that we have going in Summit County is data collection tools. The Summit County Adam Board actually initiated this process, which we thought was very good. What they're trying to do is they're trying to get a web-based case management system for their specialized dockets. They have 11 specialized dockets in Summit County, and they are creating a case management system that would be web-based, that the treatment providers could input their information in real time. And it'll also enable them to do some analyses and some reports on how successful their programs are. So that is a project we've been working very closely with the Summit County Board on. And once we get that case management system implemented, we're very close at this point. We can give you some updates on the information that they're collecting. And then lastly, in Wayne County, we have a project that was actually initiated by Commissioner Amstutz. And we had worked with him and his criminal justice planning group on a criminal justice strategic plan. They were looking at creating a 5-year plan. We'd worked with them to get a grant, and they were able to hire Kent State University to help them put together their 5-year strategic plan. With the Bowling Green State University evaluation, Justice Stratton and I have spent really the summer trying to get the remainder of the counties to respond to the survey. Out of the 48 counties that we were surveying to date, we have had 36 counties respond. And some of the preliminary findings on this report, the final report should probably be out at the beginning of the year, so we'll have it hopefully available to all of you by the time we have another steering committee meeting. But for now, the preliminary findings that we're finding are they have 23 counties reported having an active Stepping Up Advisory Committee. 24 counties have completed sequential intercept mapping. 19 counties reported that the jail and the Adam Board exchange a daily list of arrestees in order that they can connect the offenders in jail with treatment providers in the community if they were already connected. We have 20 counties reported having developed new programs or projects as a result of participating in Stepping Up, which we were very excited about that. We have 33 counties are using behavioral health screening tools on all offenders entering the jail. And 17 counties report the jail actually shares those screening results and the information they receive from them with the courts and the probation department. In regards to the Veterans Reentry Search Service, or VRSS, we have 9 municipal courts and 8 common pleas courts report using the system to identify veterans that are going through the court system. And the purpose of that is to be able to connect them with VA services. And then we had 17 counties report that they are actually using the Veterans Justice Outreach Specialist, which is provided by the VA to help make the linkage with the Veterans Administration for services for these folks. There was another section that we had surveyed folks on through the CGSU survey, and it was the Crisis Continuum. And I think this information is pretty timely considering the presentation that OMOS and Director Chris just gave us. Basically what they found were 24 counties reported actively working on developing or enhancing their Crisis Continuum services. And they identified the #1 service being either developed or enhanced is mobile response. And the #2 service being developed or enhanced is a receiving and evaluation center. 19 of the counties reported they have a plan to enhance their crisis response system. And the top 3 areas identified by the counties where technical assistance would be most beneficial to them and working in the crisis response system arena. Their #1 area was workforce development and retention. Their #2 area was financial modeling and budget development. And their #3 area was data collection and evaluation. So we found that pretty interesting. Like I said, with the final report, we should have a written report available to distribute to all of you towards the beginning of the year. We're probably pretty close to the number of counties responding. We have 2 or 3 more that we're trying to get to answer the survey. But we're pretty happy to have about 2/3 of the counties that we were trying to survey respond. So that is what's going on with our work with the counties. So I don't know if there's any questions, feel free to ask. Otherwise, I'm going to turn it back over to Justice Stratton.
don't see any questions, so thank you. And I want again just to do a shout out to Melissa Knopp. She and I started working together years ago when we were on the courts, and she eventually headed specialized dockets, and then we've worked pretty much closely ever since she and I both left, and I couldn't function without her. I like to think of myself as I'm sort of the connector and the collaborator, and she's the follow-up and does all the hard lifting and lots of the labor, and she's just been really great with these stepping up meetings, following up with the counties and setting up committees and helping them figure out what projects that they want to work on that are best. So thank you for your partnership all along the way. I appreciate it so much. So let's see. John, I just heard from John Lights. Unfortunately, he is home ill, but he assures us it is not COVID. And so what he was going to report on, so I'll just say it real quickly, is that they're basically working with Representative Stevens on House Bill 101, and it's a proposal for long-term programs for jail funding. And so if any of you are interested in that, contact John to see if you can add some support to that. We meet regularly with the County Commissioners Association. They've been very good at helping us identify who in the counties that haven't signed up yet we could try to talk to and get interested. We have just a small number of small counties that are sort of the outliers that we're trying to work on to get signed up. So we really appreciate their partnership, and we're putting regular newsletters, news items in their County Commissioner magazine or their newsletter. Sally has one coming up now on housing and the use of some special funds. So thank you to them for their partnership. And I just wanted to put a plug out again for the Veterans Reentry Search System. This is a basic system where you can, when you get your list of arrestees, you can send in the list to the VA. They will identify the vets in your jail. I push this everywhere I give a speech, every county I talk about this. We still have a ton of counties, a lot of sheriffs that are not doing this. The Sheriff's Association has sent out some notices. It's the fastest way to get resources into your county. Even courts that have robust veterans courts and a very robust intake system with the questionnaires are missing a third of the veterans who will not identify as veterans. When they're identified as veterans, their notice goes right out to the Veterans Justice Outreach Specialists, who can immediately contact them, start looking to see if they qualify for services. And every one of those veterans that qualifies for services on the federal dole comes off of your local budget. So you're spending local dollars on those 30% that you're not identifying in your jail, whoever they are, and spending local dollars on them when you could be getting some of the robust federal dollars in treatment programs, which are, especially for small counties, very, very robust. So if any of you have any say, you can push your county, your sheriff, your jail executive, probate courts, probation officers can use the system as well if your jail is not. So we're trying to figure out a way to do it on a statewide basis, because Indiana has done that. So we have a group looking at that and studying that, so that maybe when they're even arrested, they can enter it into a lead system of some sort and get them identified. But there's some issues we're working through on that. So I just want to make a pitch on that, because that's one of the fastest ways you can get some money into your county and use less local dollars on that. So got to keep pushing that. All right. So anyhow, we'll now go to our next report. The providers, the Ohio Council of Providers, Teresa Lample is now CEO of that, having taken over after Lori Chris became director. And they are in the thick of everything that's going on in so many different ways that I thought it would be great to hear from Teresa and see if she can give us an update on projects they're working on related to the issues that we're dealing with. So Teresa, can you take it away?
I sure can. Thanks. Thanks, Eve, for inviting us to share some updates and information. We appreciate the opportunity. The work that we're doing here and with the department and through the budget has just been, incredible in terms of trying to make sure we have resources available to provide services for people who have serious mental illness, who have addiction, our youth with serious emotional challenges. All of that is work that we're actively engaged in. and certainly, you know, a priority for us. Kathleen, can you pull up my slides?
Yes, I sure can. Just a moment.
Thank you. I've prepared a few slides to go through some of the things specifically that we're working on and our priorities. Just a little bit, and you can go ahead to the next slide. About the Ohio Council, I think most of you on here are familiar with our organization, but we do represent over 150 community mental health and substance use provider organizations, and our commitment is to promoting health, wellness, and recovery. It really is about how do we help people who have serious mental illness, who have addiction, our youth and families, really identify what is the wellness path that they're interested in and how do we help them in their recovery journey. You can go to the next slide. I wanted to talk a little bit about our policy and legislative priorities. You know, I think it's been mentioned several times. We are also very grateful for the budget that was introduced by the DeWine administration, the fact that the General Assembly not only supported what was introduced, but added additional resources. And then certainly all of the efforts underway that Lori and Lois described are certainly all things we're actively involved in. From our perspective, the three primary areas we're focused on are strengthening and fully financing a full continuum of behavioral health services. We know this is critically important, starting early, having the ability to do prevention and harm reduction, early intervention, and that's not just intervention with youth, but also early intervention in a disease process, early intervention if somebody has a recurrence of symptoms. But the earlier we can connect people to care, the better we have in terms of achieving good health outcomes. Certainly the treatment component is a very large focus of what we do, but we also know that it's critically important to have recovery supports. You heard Lori mention that Judy French, who's now the director at the Department of Insurance, has really taken on a priority around education and enforcement of federal insurance parity. And that's something that's really essential in terms of how do we help people and how do we help people not cycle deeper into their mental illness or an addiction before they're able to access care. From a financing perspective, so much of our system is focused and supported by federal dollars or state dollars or local resources, usually through the Medicaid program or state and local taxes. Yet if we're healthcare, which we believe we are, that behavioral health is essential health, then we need to figure out how we can more fully capture the available healthcare services and resources that are available. And then the third priority we have, which seems to be the topic of almost every conversation I have, is how do we support the behavioral health workforce development? I think the pandemic has really highlighted the challenges we have from a workforce perspective as we're seeing increased demand for mental health services, for addiction services, and more people just feeling emotional distress and seeking care. So these are the legislative priorities, all kind of founded in this understanding that behavioral health is essential health. So next slide, please. So this is information that I don't need to really hit with this group because you know it, you live it, and you breathe it. But we know that people with mental illness and addiction are disproportionately represented in our prisons and our jails. We also know that we have disproportionate numbers of minorities that are also incarcerated with mental illness or addictions. And we know that sometimes behavioral health treatment is not always accessible in our jails for a whole lot of reasons. We have numbers of gaps in our continuums of care in both treatment services and recovery supports, such as housing, the peer services that we've mentioned as well. I think those are probably the two critical ones. You know, we are experiencing a workforce shortage that has predated the pandemic, but been exacerbated by the pandemic. And those shortages mean it's challenging to find people willing to do work in community-based settings, to work non-traditional hours, evenings and weekends, to be on call. So we're trying to figure out new strategies and innovative ways to attract our workforce. Funding is always an issue because, again, we have parity issues. We have services related to Medicaid, where Medicaid can pay and is a good payer of services, but it doesn't cover my total cost. It only covers allowable costs. And so we have to figure out how we address some of the funding issues. And then, of course, stigma still plays a role in terms of our ability to provide services. And I've heard a number of things talked about today, including, our efforts to expand CIT, to bring mental health first aid training, mental health education more widely available across our communities and in all various different settings. Next slide, please. So to talk about where our members in the community behavioral health system are really working specifically with jails and communities to mitigate incarceration and recidivism, it's several of the things that we've talked about today. So specialized dockets, the multi-system adult program, we're very excited about as we've mentioned today that is kind of a seed program to really focus on person-centered care, improving access to treatment and medication while individuals are in jails, collaboration with law enforcement. And then I want to, kind of talk just briefly about certified community behavioral health clinics. So next slide. And we've talked about all of these various drug specialized dockets and the drug courts, the mental health courts, veterans courts, reentry. Many of our members are actively involved in the community partnerships to provide services. They provide the case management, they provide the treatment services, they work very closely with judges and courts and their law enforcement partners. And we know that this is a service that really does work very well in many, many communities. And it does impact recidivism. It does help people get connected to treatment. It does help people stay involved in recovery. Next slide, please. You've heard mention already, Lois did a great job talking about, the multi-system adult program. And I think this is really an opportunity to create more collaboration between providers and their county partners through their jails, their homeless shelters, and importantly, the hospitals, because I think that's an intercept point that we sometimes miss with people who really need access to care. And if we can get them connected to services in that crisis moment before they end up involved in a criminal justice experience, then we can help them get more quickly into treatment and into a road of recovery that will be much more helpful to them. Next slide, please. So talking about access to treatment, and Justice Stratton, you did a great job identifying all of various training programs that are currently going on. I think one of the things that has been most beneficial coming out of the pandemic is access to telehealth and the ability to do virtual visits that partly deals with the workforce challenges that we experience in providing that community collaboration or in-reach into the local jails, working with our law enforcement partners, but also the opportunity to really figure out how do we connect better to create that continuity of care if a person is on medication, but also then how do we use that as an opportunity to initiate medication treatment for individuals that might need it. Looking at all of the various available types of medications, whether it's the traditional antipsychotics or antidepressants, anti-manic drugs, or if it's looking at long-term injectables, or even the ability to initiate medication-assisted treatment for people who are abusing substances such as opiates or alcohol. So it's really an opportunity to help to stabilize a person and get those connected to both treatment and medications while the individual is in that jail, in that criminal justice setting. So many of our providers are actively engaged in this, and we've seen increased participation in that. Of course, one of the big challenges with all of this, because they're in an institutional setting, certainly becomes funding. And so we appreciate that there was additional resources, included in the budget to support access to medications. Next slide. But I think from our perspective, in terms of what's the most impact we can have in reducing people entering the criminal justice system in lieu of treatment is to really focus on how do we build out a full continuum of community-based services. And this has been the area that we have continued to prioritize. Crisis services and all of the work going on both with the PEGS Foundation and their Crisis Clear Pathways Initiative, with the mental health, or with the crisis task force that the Department of Mental Health is leading, and then of course 988 as being kind of another tool or resource that will be available. I think as we've gone through the history of the behavioral health redesign over the last, it's hard to believe that's been almost 4 years, but really looking at, we made significant changes to crisis from a funding perspective, from a Medicaid perspective, that really challenged the system, and I think has led to more people ending up in our criminal justice or juvenile justice response because of the lack of available resources. So this focus on crisis is so significant, it's so necessary, and there's so much good work going on to really figure out how do we create that early response that gets a person what they need, gets them connected to services, and provides that ongoing stabilization so that we're not seeing people continue to cycle through and return in an experience of crisis again. So we're really excited about this work. We're heavily involved in, I can't tell you how many different committees. Our members are excited about that. The provider system really sees this as critical to building out that continuum of care. And then certainly access to ongoing treatment. We know that we need more ACT teams. We need the ability to provide that intensive services for people who don't respond to services as usual. On the youth and adolescent side, there's a focus on building intensive home-based treatment services, which can be provided to individuals up to age 21. So it really does cross over into that adult serving system. And then making sure that we have the range of outpatient treatment services available and access to medication management. And I think the access to psychiatric services is really important because I think it's one of the areas where we see the largest workforce shortage. Having access to psychiatrists and advanced practice psychiatric nurses to be able to provide that level of intervention in a holistic way that in combination with other treatment services. And then finally, recovery supports. We understand very clearly that when we're trying to figure out what does a person need, many times it's not that they need just treatment services. It's a lack of housing, it's a lack of employment services, and it's peer support. Those are the things that help people from the long-term perspective get to long-term recovery and their ability to live, in a community, in a family, be successful, and have the type of life that they want for themselves and that we want to see them succeed. And then, there's a lot of collaboration going on with local law enforcement. We're very excited about the work that our members are doing in collaboration with CIT training, providing ride-alongs, providing the ability to come see what it's like to work in a community behavioral health centers. The DART teams, there are providers looking at the CAHOOTS model. There are co-responder models that are developing. And so we're really excited to see that collaboration that has expanded. And I think a lot of that is due to the work that Stepping Up has been providing some leadership and supports to develop in local communities. All right, next slide. So I'll wrap up, my presentation by talking about something that I'm personally really excited about, and that's the development of certified community behavioral health clinics. So CCBHCs, as they're referred to, it's a new best practice that's been around for probably about 10 years. 20 years in the development, frankly, since I've been here, we've been talking about how do we provide integrated care. And when we say integrated care, that it's integrated mental health and substance use disorder treatment that's also provided with access to primary care services. We know for too many years that individuals with serious mental illness die sooner. They have a 25-year premature death rate, not due to their mental illness necessarily, because of their untreated health needs. And so how do we create a model of care that meets the holistic person? It meets the person where they are. It addresses the whole person, and it's financially, it's a sustainable model that looks at providing a prospective payment rate. So CCBHC has been drastically expanded in the last 5 years. It started with a CCBHC expansion grant that was in 8 states. Ohio opted not to be one of those states during the previous administration. But since that time, there are now 40 states that have engaged in development of CCBHCs, and there are over 340 clinics operating now across the country. And the importance of this is this model dramatically increases access to mental health and substance use disorder services. It expands capacity to address overdose. It establishes partnerships with law enforcement, with schools, and with hospitals. And it's been demonstrated to reduce recidivism and prevent hospital readmissions. So at the end of the day, what they're finding from the evidence is that it works. Next slide, please. So in Ohio, this has become important because in the last 18 months, we have had 15 organizations really kind of dispersed evenly geographically across Ohio that have received SAMHSA CCBHC expansion grants. So even though Ohio hasn't officially adopted a policy to develop CCBHC from a implementation standpoint, we have 15 organizations that are actively engaged in developing the model. And the model is important because when you look at what it provides, it really is this comprehensive, holistic service. Every organization that's a CCBHC has to have crisis services for adults and children. It has to be able to do immediate screening and risk assessment, treatment of co-occurring mental health and substance use disorders. The foundation of treatment and treatment planning and case management is a patient-centered approach for both treatment planning and care coordination. It includes physical health care services, services to support veterans, and that it includes requirements for peer support and psychiatric rehabilitation services. It's a standardized model, so everybody that is any organization that is a CCBHC provides this range of services. There's also a standard data collection requirement so that we're gathering information to demonstrate that we're getting good clinical outcomes and that people are responding to the way that we would anticipate, and that overall their health and wellness is improving. And I want to talk just a little bit about what it really looks like from an actual practical standpoint. One of our organizations that received this grant, I think they're in year 2, they're about 16 months into it. And we asked that organization to just share with us, tell us what are some of the initiatives that you've seen as the development of CCBHC. And when they sent me this list of like 15 bullet points, 13 of them involved law enforcement, working with their criminal justice courts, working with their specialized dockets, developing relationships with forensic monitoring, creating transition programs, jail linkages, working with their family recovery courts, providing mental health first aid to their police department, EMS, fire departments. So it really is focused on how do we provide the most outreach to individuals with serious mental illness and creating systems that brings them into this opportunity for whole person, holistic and trauma-informed care. So it's something that we're very excited about. We're excited to see where this can go and how we can grow this particular model of care. Because at the end of the day, I think this is how we can change the system to really be that person-centered access point where a person with a serious mental illness can go and feel respected, get access to the services that they need, and be connected to then any other specialty service, community support that will help them really get to that point of recovery that allows them to be successful. So with that, that's kind of the priorities that we're working on. I thank you for the chance to share, some of the work that we're engaged in today. If you go to the last slide, you'll have my, oh, sorry, one more slide. I wouldn't be remiss if I didn't talk about the barriers. We've talked about this already in many respects, but the workforce challenges that we're experiencing right now are probably the most challenging that I've seen in the almost 30 years I've been in the field. We simply have to find ways to value the workforce that we have, to understand and create this kind of notion that behavioral health is healthcare. We have to work on career pathways and find new ways to attract people into doing this work, and we have to find innovative ways for recruitment, retention, and development. There's not a CEO that I don't talk to on a weekly basis who doesn't share what the latest challenge is from a workforce perspective. And we're not losing workforce to other sectors in healthcare. We're now losing them to the service industry. We're competing with Target, with Walmart, with McDonald's, with Taco Bell. And Dunkin' Donuts, I can't leave them out because they're currently leading the list at $22 an hour as a starting salary plus sign-on bonuses. And that's just challenging for us to compete with, given the work that we do. We've talked about the gaps in the continuum of care and where we really have more opportunity to do work in addition to those that we're addressing. And then sustainable reimbursement. We really have to address some of the challenges in our Medicaid financing. In Medicare, recognizing the full range of available professionals would double the amount of workforce available to treat individuals who are covered under the Medicare program, and then certainly insurance parity. So then I will go to my last slide, which is to say thank you. And I've listed myself and Sole Hernandez for my team, who is spending a lot of her time doing the crisis work. She also has done some of our criminal justice work. She's on the AG's task force for representing the Ohio Council, and either one of us are available to answer any questions or provide any additional information. So again, thank you for the opportunity to talk today. It's good to see so many of you.
Thank you so much, Teresa. And that was a very robust report, lots of great information. Really appreciate the comprehensive review that you gave us of all the work here. So integral to every single piece of the work that's happening on the ground. So we thank you for your partnership and leadership there. So next on our agenda, I can't see them on the list of attendees, or they may be calling in by phone because that doesn't show me who. Sheriff Heldman or Bob Cornwell for the Sheriff's Association and jail updates. Are either of you on the line or available to present? I'm not hearing anyone. Okay, I don't know what happened to them. They got notice of the meeting, so we'll see where they are. So anyhow, if they show up, please send me a chat and tell me you're ready to present. So we'll pivot then to Carlton Moore and Lisa Schoff, who we work with very closely. Melissa and I meet regularly with them. They're partners on a lot of our committees, and Lisa Schoff heads our policy and research committee. I believe that's the one. Anyhow, they're going to talk about what's happening with the Office of Criminal Justice Services. And I've asked them to just give a little summary of what that office does. Sometimes people don't really understand and know exactly what their office does and is in charge of. So if they could just give us a little quick primer on that, it would be very helpful.
All right. Well, thank you, Justice Stratton, for the opportunity to speak to the committee. As you indicated, I'm joined today by Lisa Schoff, who I think everyone knows. And actually, Steve Click is joining me too. Steve recently joined our office and he handles our wellness efforts. And so I will turn it over to him for a little bit to talk about some of the work that he's doing in the area of wellness. It's funny, people often ask me what I do, and as I go into the description, their eyes kind of glaze over a little bit, and I know they're not still with me anymore. But the big thing that I think people know us for is that we administer lots and lots of federal criminal justice grants and a growing list of state grants, and I'll go into that. We also do evaluations of programs. We do research. We administer the state's NIBRS program, the National Incident-Based Reporting System. We administer that program. So we have all types of crime stats that come to our office. We house the state's anti-human trafficking coordinator. We're very involved in lots and lots of policy efforts, from the Ohio Collaborative to implementation of the electronic warrant system, and kind of on and on and on. And as new issues present themselves, new criminal justice issues, typically we are going to be a part of those discussions, and then oftentimes a part of solving or attempting to solve some part of some issue. You know, the last time I was here, I did have an opportunity to talk to you all, and I spoke to you about the Ohio Collaborative Community Police Advisory Council. So I am going to give you an update on some of the work of the collaborative with really a special focus on the work that we've done since last summer. And then I will turn things over to Steve Click, and he'll talk a little bit about our wellness efforts. And then I'll come back and talk about some of our funding opportunities that we have right now, which are really extensions of some of the policy topics that we're very much focused on. So as many of you know, the Ohio Collaborative was created back in 2015. It was created by executive order, and it was a result of the work of the Governor's Task Force on Community Police Relations, and that task force was created after the deaths of Tamir Rice and John Crawford III. And so that task force went around the state and held public meetings to try to figure out ways to improve the important relationship between law enforcement agencies and the communities they serve. And I should say, because I tried to say this every time, between some law enforcement agencies and some communities, because we certainly know that as you go across our state and you go across the country, there are some agencies that have very good relationships with their communities, and there are some who need some assistance with improving that relationship. But that was the task that the task force was given. And one of the recommendations, so after all of the meetings, we wrote up a report. Actually, Lisa Schoff and I were the primary authors of that report. And it had a whole host of recommendations in the report. There are about 170 to 180 so recommendations that were in that task force report on ways to improve that relationship. And one of the recommendations was to create standards for law enforcement agencies. This came as a surprise to many people to not understand that law enforcement agencies do not have required standards. And I don't want to leave you with the impression that they don't have standards, because they do. But while each individual officer has training that they have to go through in order to become an officer, and we have some CPT training, depending on whether or not there's funding made available by the legislature, that officers have to take each year. In order to be a law enforcement agency, there are no standards. There are actually no standards that you have to meet as an agency. There's actually only one policy that you have to have in place if you are a law enforcement agency, and you have to have a policy on pursuits. There's nothing that says what has to be in that policy, but you have to have a policy on pursuits. So the collaborative was created. The collaborative is a 12-person board whose responsibility is to develop standards, and the standards are voluntary, standards for law enforcement agencies to adopt and implement. The first standards that agencies had to adopt and implement were actually in the executive order, and that was on the use of force, including deadly force, and hiring and recruitment. So we had, I'm not sure how many standards we had at the time that I last spoke to you all, but we now have 11 standards. And I'll get into some of the standards that we've passed in the last year or so. But we now have 11 standards. In terms of adoption of those standards, we have about 85%, almost 86% of all officers in Ohio are part of an agency who has either adopted our collaborative standards or is in the process of adopting the standards. About 85% of Ohio's population is covered by and served by an agency who has adopted the collaborative standards. So I think we've made significant progress since the last time I had a chance to talk to you. Now, certainly a lot of the work that we've focused on in the last year has really been shaped by one central event, and that was the murder of George Floyd. After that event last summer, Governor DeWine came to us and said he wanted us to look at developing a standard on law enforcement response to mass protest and to mass demonstrations. And so we did that. We actually engaged a lot of partners, not just here in Ohio, but all across the country, to try to create the best standard that we possibly could. And I think we created a really good standard on response. And if any of you had a chance to watch any of the videos, and there were all kinds, I mean, hours and hours of videos from protests from last summer. In terms of the law enforcement response, you saw some things that were outstanding. I think I saw some things that were quite inspiring, but at the same time, we saw things that were not outstanding, that were not helpful, and that did great harm. And so establishing standards for the way that law enforcement should respond in those efforts, that was a priority, and that was something that we did. Now, keep in mind, many agencies last summer had protests who had never had any type of protests before. And as we were developing this standard, I started to get calls from people all across Ohio. I did get a call from one deputy sheriff. We actually grew up in the same town together. He's not a deputy in that town, but he shared with me that he had not had any training on how to respond to any type of protest since he was at Clark State back in the 80s. And so many agencies were just not prepared to deal with something like this. And the standard on mass protests and mass demonstrations is a great guide for agencies in and outside of Ohio to utilize when addressing issues like this. We also changed our use of force standard. We changed our use of force standard to ban the use of neck restraints unless deadly force would be justified. At the same time that we made this decision, or actually shortly after we made this decision in Ohio to ban the use of neck restraints, the federal government also decided that that was a good move, and they created a federal certification on use of force that also asked agencies to ban the use of neck restraints, limited to only those times when deadly force would be justified. In Ohio, we have 646 out of 879 agencies who have adopted our new use of force standard and banned the use of neck restraints, limited to very specific circumstances. The last thing I want to talk about before I turn it over to Steve is a wellness standard. And so this had been a topic that we had visited a number of times, and we'd had a number of presentations from people in Ohio, from agencies, from experts on how to approach the area of agency wellness. And so our very last meeting that we had on wellness, we had a presentation from a police officer from Cincinnati. And it was probably, I would say, the most impactful collaborative meeting that I've ever been a part of. This officer, and I think it's always important when you're talking about these issues, is to be able to provide the collaborative with the real world reality of the importance of these issues and how they affect people. This officer had, prior to being on the, well, actually, he was a member of the police force at that time, but he had been involved in something that was not at all related to his job. And it had never been dealt with. It was a pretty traumatic experience that he was involved in, and it had never been dealt with. Fast forward 20 years later, he is the supervisor on a police chase. And as a result of that chase, there were a number of fatalities. And now he's having difficulty dealing with this issue, and he's really now dealing with both his current issue and the one that had never been dealt with before, and it only compounded his problems. His agency, he didn't feel like was really ready to provide him with all the services he needed. The people who were under his command understood that he was struggling. They didn't know what to do to provide him with the assistance and support that he needed. And certainly those issues that he was dealing with not only impacted the way he interacted with people in his department and his family, but of course it impacted the way he dealt with the community that he was charged with serving. I asked him how it impacted people in his community, and he indicated that he saw people as threats. He saw almost everyone as a threat, and certainly that would make it far more difficult for him to be the type of police officer that he had been throughout his career. So we created the agency wellness standard, not just for the sworn officers, but for the entire agency. And I just want to read to you the purpose of the standard. All the standards that we pass have a purpose area, then they have required components, and then they have things that agencies should think about when drafting their policy. So here's the purpose area. Law enforcement agencies have an obligation to ensure the mental and physical health and safety of their agency personnel. Officer wellness is not only an individual issue, it is also an agency issue and a public issue, as the negative consequences of poor mental and physical health can impact officer performance and affect community relationships. Law enforcement agencies are uniquely situated to address issues of officer stress and trauma, to reduce the stigma of seeking help, and to create an environment of support. So that is the purpose area of our agency wellness standard. And as we were developing this standard, I thought that we would see an increased demand from people inside of law enforcement to be able to access services, wellness services. And so I thought it was important that we have a resource on our staff that could help guide people through that process, inform agencies of best practices and ways to seek service. And so I engaged Steve Click and was able to finally convince him to come back to his home, public safety, where I initially got to know Steve. And so with that, I will turn things over to Steve to talk about some of the wellness efforts that he's engaged in.
Thank you so much, Director Moore. First, I want to start by thanking Director Chris and the Ohio Mental Health and Addiction Services for beginning this work with addressing the mental wellness of first responders by creating the first responder liaison position back in 2018. And we still are fortunate in that we have a great partnership and relationship with Bureau Chief Chris Nicastro over at OMAS. We continue to work with them on a number of projects and initiatives, which is very exciting. Again, I'm the Director of First Responder Wellness for the Ohio Department of Public Safety, Office of Criminal Justice Services. That also includes working with fire, EMS, corrections, dispatch, even some Ohio-based military. Any of the times that I can offer assistance to those agencies, in addition to other state agencies. I'm recently in conversations with the Ohio Department of Transportation, going to be doing some work with them, the Franklin County Juvenile Court System, and was just yesterday down at the Hamilton County Communication Center in Hamilton County for their dispatch covering mental health first aid. To date, this year, I've been involved in 67 presentations, 18 since coming over to Criminal Justice Services, for a total of 2,766 persons that we've been able to talk to, 989 since coming over to Criminal Justice Services. We're also working with the Ohio Suicide Prevention Foundation. We've got a small work group that includes police and fire. We're working with Austin Lucas and the folks at OSPF on addressing the concerns of first responder suicide. A lot of people aren't aware, but we lose 2.5 to 3 times the number of police and fire every year to suicide that we do to line of duty, excluding COVID. And unfortunately, that 2.5 to 3 times number is at a 40 to 45% reporting rate. So we know that that number is much higher than we actually know of, as this has been an area of concern for OSPF. Tony Coder, Austin Lucas, and the folks over at OSPF have been working hard to include first responders as a part of the statewide suicide prevention plan. And we have a specific work group that is addressing how we can focus on first responders. We recently met with a grad student from Ohio State with OSPF, and he's doing a number of interviews around the state and how to best address certain communities, first responders being one of them. We offer a number of trainings to agencies across the state of Ohio, completely free of charge. There's no cost to them. There's no cost to the agency, including crisis awareness, that we can include addiction awareness, self-care. We do a class on retirement as first responders are preparing to retire and start that next chapter of their life. We offer QPR, Question, Persuade, and Refer, which is a national evidence-based suicide education awareness and prevention program. Soon as I finish my second team teaching project with mental health first aid, we'll be offering that as well. We also offer a course called After the Call. What does an agency do when they lose somebody to line of duty, accident, or suicide? That course is not telling any agency what to do, but merely starting the conversation. Again, as Director Moore said, we have a lot of agencies across the state of Ohio that maybe have never been faced with that situation, an on-duty death or a suicide or something of that nature. And when that happens, we want to provide them some ideas, some resources, actually before that happens, so that they're prepared for it and they know what to do and they have a plan in place, so that when that thing happens and they're dealing with all the emotion that goes along with that, they can go ahead and do the best thing they can for their personnel. Again, continuing to work with a number of agencies across the state of Ohio, including the Ohio Attorney General's Office, the Ohio Peace Officers Training Academy, the State Fire Academy, just working with as many folks as we can in promoting wellness for our first responders. We're seeing a staffing issue across the board with police and fire and dispatch. We're all aware of that. We think it's important to do what we can to help make those folks that are continuing in those occupations or those folks entering those occupations, to keep them as healthy as we can, to provide them the resources that they need in order to be healthy, provide resources for their families and so forth. So part of my job is to continue to promote the wellness standard as put forth by the collaborative and provide any of these trainings to agencies across the state of Ohio and partner with any of the state agencies that would request assistance. So that's pretty much a quick recap of my program. If there's anything that I can ever do for the folks on this call, I recognize a lot of names, which is wonderful. Please don't hesitate to reach out, and I will be happy to provide you any assistance I possibly can. Director.
Thank you so much, Steve. That's incredibly helpful. So Steve did mention the shortage of first responders. And so one of the other things that we are focused on here at the Office of Criminal Justice Services, this also happened last year, and that is Governor DeWine asked us to create the Office of Law Enforcement Recruitment. And so when the governor asks, we typically comply. And so we did. We created that office. It's headed by Sarah Shindy. Some of you may know Sarah. I tell you, she is one of the most energetic, committed, just incredibly professional. She never stops recruiting. She recruits all hours of the day and night, and she helps agencies update their recruiting efforts. We have 3 people who are working and supporting that mission. to assist agencies in developing and sharing the best practices on the hiring of candidates who are suited for the law enforcement profession. I think this really goes nicely with the work of the collaborative. As I indicated earlier, the first two standards that the collaborative created were on the use of force, including deadly force, and on hiring and recruitment, because the most important thing that I think every agency does, or any entity does, is hire people to do a job and to meet their mission. And so the office is there to assist agencies as they try to bring new people into the fold to be police officers. One of the ways that we're doing this is through a program we call the College to Law Enforcement Pathway Program. It is a partnership between the recruitment office and then a number of law enforcement agencies in Ohio, and then two universities. And really the purpose of it is to partner universities with criminal justice students who are interested in becoming police officers. And as they go through this process in their junior and senior year of college, they will have mentorships with prospective agencies and really start to form that relationship. They'll get additional courses and seminars on what it's like to be a police officer. We do a lot of the background work that will take some of the burden off of communities who have sometimes end up hiring people and spending an awful lot of time and resources only to find that the person can't quite, whether it's they can't get through the background check or pass the polygraph or hit the physical fitness goals, or whatever the case may be. And so this is a really good partnership. And basically it's like this: if you are accepted into this program and you make it through, you are guaranteed a job at the end of that program with one of the agencies that is a part of our program. So we're going to be looking at this program for about 2 years. After that 2-year period, we will open it up to additional agencies and additional universities. We also had some grant money to go along with that recruitment effort, and this was funding that gave agencies an opportunity to really refresh their recruiting efforts and their retention efforts. And so we've been able to, that RFP is actually closed, and we'll be in the process of evaluating those grants and awarding those grants. One of the other funding opportunities that we have that is open right now, that's the Ohio Body-Worn Camera Grant Program. This is $10 million over 2 years. It is to create and or expand body-worn camera programs. It's open to all law enforcement agencies here in Ohio. Certainly, we will pay for all types of costs related to body-worn camera programs, from personnel costs to the cost of dealing with public records and redaction efforts, to issues of storage. But our priority is on expanding the number of officers in our state who are equipped with body-worn cameras. So that's our priority. One of the things that we want to make sure that people do is that they create policies around the use of the body-worn camera that makes sense. So one thing that people are required to do is to adopt and implement the body-worn camera standard that it was established by the Ohio Collaborative. Applications are due by October 8th for that grant program. It is $5 million this year, and then an additional $5 million next year. Soon we will be releasing another grant program. That's the Ohio Violent Crime Reduction Grant Program. I think we're all mindful of the increases in violent crime that have occurred. Certainly next week, we will find out the full depth of the increases in violent crime from last year. And certainly we have the opportunity to look at those numbers. And we also, as I said earlier, we administer the NIBRS program. So we have a chance as the year goes on. We don't usually have to wait until the following year to find out what happened in that year. And so I can tell you that while we've seen some reductions in some areas, in certain areas, those numbers continue to go up. So the Violent Crime Reduction Grant Program, it is $8 million over 2 years to create and implement and/or expand promising or proven violent crime reduction strategies. It is open to all law enforcement agencies. We would certainly urge agencies to look at partnering with community agencies, academic, behavioral health, anything that they can bring that can have an impact on reducing violent crime. Priority is given to those agencies that develop a comprehensive plan to reduce violence and that involve allied criminal justice partners and other relevant partners, including community members in strategy development. So that is another grant program. We expect to release that shortly in the next couple of weeks, and that is $4 million over $4 million this year, and then another $4 million the following year. Also, a grant program we have open right now are the extradition reimbursement grants. This is $500,000 over 2 years. This actually comes from some of the other policy work that we did with the warrant task force. And one of the things that we found why warrants were not being cleared is because agencies couldn't afford, whether it is to go pick someone up outside of our state or to pick people up in different counties in our state. So these funds are available. Like I said, it's $500,000 over the course of the biennium, and that is to reimburse local law enforcement for the cost of returned wanted violent criminals arrested on outstanding warrants. There's no deadline for submitting these applications. So that is another grant program that is open. And then the last one that I'll mention that is open right now, and that is the Coronavirus Emergency Supplemental Fund. We actually have a little less than $500,000 left in this fund. That is open today. I would urge people, if you have expenses that are responsive to coronavirus. And I think a lot of ways that you can look at this if you're trying to figure out, well, how can I do this? Things that make your organization more mobile or make contact between people less necessary. These are certainly things that could apply for the CESF funds. That block closes in January, at the end of January. So we are really focused on getting that funding out as soon as possible. You can go to our website and apply for those grant dollars. That concludes my prepared remarks, and I'd be happy to answer any questions. Again, thank you, Justice Stratton, for the invitation.
Thank you so much. And most of these grants we try to put in the newsletter. You should be getting the newsletter as part of the steering committee. And we try to focus on those so that you can hopefully republish the newsletter, send it out to your association members or whoever you think in your counties or your agencies can take advantage of this funding. We try not to put in the newsletter just a lot of reports and studies and that. We try to focus on things that can benefit you, like the funding, different funding opportunities, free trainings. We usually don't put in trainings that cost money, with a couple exceptions here and there, so that you can tackle these resources. So I just wanted to make sure you all take a look at that newsletter when it comes out and see if there's something you can send on to your membership for perhaps trying to get some of these funds into your community. I have not been able to raise the good sheriff or Bob Cornwell, so I'm not quite sure what happened there. But Ruth Samara, are you still on the line? Do you want to just take a few moments to update on CIT issues like you do in our county meetings? I'm putting you on the spot, I know, so I thought I'd check with you.
Hi, Justice Stratton. Yeah, I'm still here, and I'll do my best off the top of my head to give a quick update about CIT. We are, of course, still providing technical assistance and training consultation, et cetera, around the state to CIT programs. I think most everybody's aware that we already have trained CIT officers in all 88 counties, but that doesn't mean that all law enforcement jurisdictions are necessarily fully participating in CIT. We still have about 5 counties that don't operate their own CIT program or training, so the officers seek that training in their neighboring communities, but we've got good collaboration across the counties to make that happen. Roughly 76% of all law enforcement jurisdictions in the state do participate in CIT training and programming. With the funding that we have from the Ohio Department of Mental Health and Addiction Services, we just wrapped up an 18-month support and expansion project in which we had, and I forgive me, I don't have these numbers in front of me, but we had, I believe, roughly 30 or more of our CIT programs that we provided local support and expansion grants to so that they could expand on all of the core elements of CIT. And since I have the floor for a second, I always like to take the opportunity to remind people that, crisis intervention teams are really community-based crisis response partnerships. It's not a law enforcement program per se. The law enforcement training component of that is just that. It's a component of a meaningful program. So when I talk about, grants and work being done at the local level on the core elements, that might mean that they're working on policy development between law enforcement and mental health to ensure that they've got comprehensive and complementary policies for the encounters with individuals in the community who have mental illness and what steps should be taken toward that. It may mean that they're working on data collection, and by data collection, I mean capturing encounter information in a meaningful way so that they can evaluate their CIT program and also ensure that the information that is obtained by the officer on the scene in the community is as quickly as possible relayed to the mental health community, and the mental health system has a response mechanism in place to follow up with those individuals. The crisis response work that's going on across the state is going to help supplement and support that because we're all aware of some of the shortcomings that we've had. So our local communities in the meantime are, we work on some workarounds to try to manage those missing pieces and gaps in their systems. But because CIT is such a partnership program, and we do have some really strong partnerships in Ohio, most of the responses end as well as they can under the current circumstances. We're currently working on rolling out our next batch of subawards or local grants to communities. We expect to be able to do at least 20 of those again this year, actively working with communities on what their next steps are, which may include those policies or data collection, but they might also include increasing their steering committees to get better cross-system representation on their crisis response steering committees. They may include beefing up their training to bring it up to new standards. We try to stay on top of those kinds of things. They also include trying to identify CIT coordinators or at least points of contact in all of the law enforcement jurisdictions that are currently active in CIT. And there's a whole laundry list of things that communities may work on. Some of the things that we'll be doing as a statewide initiative with those dollars will be continuing to provide mental health training to public defenders and assigned counsel who work with people with serious mental illness who become involved in the justice system, and trying to encourage earlier representation with those individuals whenever humanly possible. We will continue to do CIT coordinator training and to roll out a training of trainers for the folks in the communities who will be doing the CIT training for public safety telecommunicators. So your 911 dispatchers and call takers. And who knows, in the future, as 988 comes into development and that works more closely with 911, perhaps that will involve some of the hotline workers to make sure there's good cross training. We are also in the process of developing a pilot cross training for multiple systems. We'll be piloting that in Summit County this year, whereby bringing stakeholders together from many systems who touch on the lives of people with serious mental illness to help them better understand each other's systems and create better continuity of care at the local level. And we're hoping that that training will be able to be replicated in other communities. And there's a long list of other things that are on our goals for this year. It's a very aggressive list of goals this year, but we do appreciate the support from the state, and the communities really appreciate it. Things are going very well on that front, and we have over 13,000 officers that have been trained to date. And if you add in the other stakeholders and partners that have been trained, it's up over 18,000. So it's a busy program, but again, I would stress the partnership portion of it. Is there anything particular, Justice Stratton, that I missed that you would like me to address?
For being called on for the spur of the moment, doing off the top of your head, that's a pretty impressive presentation. So thank you. No,
Sure.
I think that just gives everybody a good summary of what's happening with law enforcement and the tremendous progress we've made in Ohio with CIT from the days years ago when I started trying to promote this with 100 officers and Lieutenant Woody as my partner in those early days. So yeah, thank you so much, and I appreciate that. So we are at the end of our program. I just wanted to give anyone who's on the call an opportunity to talk about anything they want to present or bring up before I close it, and thank everybody. So anyone have anything further? Not hearing anybody volunteer at this point, so you get a good half hour of your day back to grab some lunch before your next event. I wanted to thank all of our presenters. I hope you found this update very informative and interesting. Especially we had some new partners for the event. Carlton, thank you so much, and Steve Click for that update. That's just such a valuable resource. I just want to make sure people are always aware of it. And also Teresa Lampel with the Ohio Council, just some great updates there. Such a partner in so many things. And of course, all the work that the Department of Mental Health is doing with Lori and Lois and all their staff. Wonderful supports that they've given us. So, and again, a final thank you to my team, the Stepping Up Core team, who really works hard because we do 2 of these presentations a month, and that takes a lot of work. Every one of the team members calls their counterpart. NAMI calls their counterpart. Ruth Samara talks to her CIT counterparts. Hallie Lucan talks to their housing counterparts. And Melissa and I talk to all the judges and ask them to present. And we talk to the sheriff, and it takes a lot of phone call and a lot of work to do these. But because we do them by Zoom, like I said before, we've had almost double the attendance. Plus, our team is 8 now. When we started, it was Tom Craig and me with 2. And it's been very hard to take a team of 8 all across the state twice a month. So this has really expanded our ability to reach out to new ones. We have Lake County coming up, Union County coming up, and Franklin County coming up as our new presentations. There's one more, Portage County. So we've got 4 coming up that we're all preparing and working on right now. So if any of you have interest in those counties, please let us know. So again, thank you to all the partners. Thank you to the steering committee. We sure appreciate all the collaboration and the work you all do together, and enjoy your weekend. The sun is starting to come out a little bit here, so that's some good positive news to end on. Thank you.